In today's video, we are going to see what causes belching and 10 simple tips to reduce belching. Hi friends, I am Dr. Karamath. This is Scientific Doctor channel. In this channel, every week a health related information is explained via a simple video. If you want to see such videos, consider subscribing to this channel. Also, press the bell icon adjacent to the subscribe button to get instant notifications whenever new content is released. Today's video is about belching and remedies to stop it. What is belching? Belching, burping or eructations, which are the other names for belching. Belching is a natural body's way of releasing the air from the upper part of the digestive tract. Now, where does this air come from? This air often comes from swallowing. So, if you have swallowed excess air, this air gets released via your mouth from the stomach and the esophagus, that is the food pipe. It is released via your mouth with an audible sound, which is called a burp or a belch. So, why do you swallow air? What are the reasons for belching? When you eat fast, you tend to swallow a lot of air instead of when you eat leisurely or slowly. And when you are talking while eating, especially while you are chewing, still you are talking, you tend to swallow a lot of air. Also, when you eat hard candies, when you chew hard candies or when you chew chewing gums, again you tend to swallow a lot of air. When people smoke, they also ingest air along with that smoke. Carbonated beverages like sodas or beer contain gas, which again, if it is taken, that again goes into the stomach. It needs to get expelled. If there are loose dentures, if it is not fitting properly, again when you are chewing, it leads to lot of air going into the digestive tract. And when you are anxious, again you tend to swallow air involuntarily without you knowing it. Apart from these reasons, you have some of the medical causes like heartburns or acid reflux. Whenever because of acid peptic disease there is excess acid production or some other reason, the acid gets refluxed into the food pipe. This causes heartburns, and this also can cause excess swallowing of air and also belching. Whenever you have acid peptic disease, that is like gastric ulcers, you again tend to swallow a lot of air, you can have belching. When you have a infection of the bacteria Helicobacter pylori, H. pylori, this is again associated closely with acid peptic disease. So if you have this infection, this again tends to cause belching. So these are all the probable causes of belching. Very rarely chronic heartburns or acid reflux can inflame the lining of your food pipe, which can cause belching. But if it is left untreated for a long time, this may lead to cancer of the food pipe lining. This again can result in belching. So belching usually results from simple causes, but very rarely it can be due to a serious disease like a cancer of the food pipe or the esophagus. So having seen the causes of belching, how to avoid this, or what are the 10 tips to avoid or reduce belching? Simply, whatever I have said in the causes, just try to reduce them. You will control your belching. So whenever you are eating food or drinking, you have to do it slowly and leisurely. So reduce your hastiness while eating and drinking. This will reduce belching. Also, eat in smaller amounts. So rather than a large meal, if you split your meal into smaller meals, this again reduces the tendency for belching. Do not talk while chewing, and similarly do not be on the run. So if you are walking and eating, you tend to swallow a lot of air. So don't do that. Your belching will come down. Do not smoke. Obviously, reducing smoking will help in preventing or reducing belching. Avoid hard candies, avoid chewing gums, avoid carbonated beverages and avoid beer, because these gas containing drinks, if you ingest them, anyway the stomach can't have that gas, excess air, it has to be belched out. Check your dentures. If they are ill-fitting, correct it with your dentist. This will help in reducing belching. After every meal, have a short walk. So, being active, especially after eating, helps in reducing belching. And simple antacids, which are available over-the-counter preparations, can help in mild belching due to acid peptic disease or due to heartburns. You can have antacids as a over-counter medication, but only if the belching is minor. When you are not only having burping or belching, but associated with that you have other symptoms like sour taste in the mouth, which is persistent, and if you have chest pain, if you have stomach pain, so if these symptoms are present, especially if the belching is persistent, you need to visit the doctor. So belching is a nature's normal way of expelling the swallowed excess air. This is not dangerous in majority of circumstances. With simple measures, we can reduce belching. But if it is persistent, kindly visit the doctor to ascertain the cause and to treat and get better. This was a short video on belching or burping. If you like this video, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.